I'm Chad Swanson, and I'm an emergency physician, and I'm on a journey to understand and transform our health system. I've spent the last night camping out in this beautiful spot, kind of in the middle of nowhere, and it's been refreshing for me and rejuvenating, and I feel at peace. And I started thinking, what effect does being outdoors have on our health and on our well-being? So I found a scientific article that was published in 2018 that I thought I would summarize for you. This is part of daily videos that I'm publishing that are informal conversations about transforming health systems. So I hope that you'll consider commenting or criticizing what I have to say. So this was a systematic review and meta-analysis, and that's when authors review all the published literature that they can find and identify a number of articles that fit certain criteria. So they initially found 9,000 articles and whittled it down to 143. And the question they asked was, what does green space exposure have on a wide range of health outcomes? There were a number of theoretical benefits that I thought of as well. One is being outside gives us the opportunity for physical activity. Another is that, and I find that I love hiking. I find that hiking and backpacking, I find that being outside gives me that opportunity. Another theoretical benefit of being in green outside spaces is for social activity. We know that social interaction has a tremendous positive impact on our health. A third potential benefit is exposure to sunlight, which can improve seasonal affective disorder and raise our vitamin D levels. And then finally, this is something I hadn't thought of, but we are exposed to microorganisms, which can improve our immune function. And so the articles that they found, interestingly, I think 96% were within the last 10 years, which would be from 2008 to 2018, so fairly recent, and all of them were since 1984. So there's been an increased interest in this idea. They found that salivary cortisol levels, so the chemical messenger in our body that's a stress hormone, was decreased. And it was decreased by an odds ratio of 0.06. And that's when researchers look at the result of an exposure to something compared to not being exposed to that. So the exposure here is to green, beautiful environments. They found that resting heart rate was decreased with an odds ratio of a really large odds ratio of 3.47. And then diastolic blood pressure, the bottom number on our blood pressure, was decreased by a large number as well, so less than 1.97. They also found a reduction in diabetes, in death rates overall, all-cause mortality, and stroke levels, as well as people would report better health overall. And there were a number of other markers that were increased or improved with exposure to green spaces, including preterm birth was one that I remember. So as I think about this from a health systems perspective, as we broaden the way we think about health systems, you might imagine a system of doctors and nurses, but also community members and researchers and educators and activists who are all interested in the well-being of society and are all part of the health system. They might be incentivized and have a vision for green spaces in our communities and in our states and societies and nations, and that could lead to improved health and well-being overall. I'd like to know your thoughts. What are your experience with being outside in the green or the brown with nature, and how does that improve your health and well-being, and what implications do you see for health systems transformation? Thank you.